Morning and welcome to all my dears. Today we are going to discuss about cancer. As you know, in our clinical practice, we may came to know that our patient is having cancer, usually at the end stages of cancer. Because in early stages of cancer, the case may be purely asymptomatic, or even though there may be symptoms, the symptoms are very vague or non-specific or subtle, and in some other cases the symptoms may mimicking with some other disorders. So there is a great possibility of maldiagnosis, malmanagement, or maltreatment, and finally the clear-cut diagnosis can occur usually at the end stage of pathology. That is the main risk or issue behind the cancer. In Kerala, near about more than 2 lakhs of people having various cancers, and at the same time on every year near about 40,000 cases of cancers were recorded in cancer registry, and more than hundreds of cases were diagnosed on every day in various hospitals. As you know, there are various causes of cancer is there, but the most triggering cause of cancer is mainly due to our lifestyle. And second is about food style, and genetic plays after the lifestyle issue and food style issue. That is the reality behind the cancer. So let us study the various causes of cancer in detail. These causes are collectively known as carcinogens. The carcinogens are nothing but the conditions or factors which excite or bring a condition of cancer, and the same may maintain even after the withdrawal of the issue. So these carcinogens may initiate the process in the target organ, and even after the withdrawal of the same, the cancer will continue in the body and the target organ acting as a maintaining cause. Next, about the different types of carcinogens. The common carcinogens are physical carcinogens, then chemical carcinogens, then biological carcinogens, hormonal carcinogens, and viral carcinogens. So the factors or conditions can be categorized as physical, chemical, biological, hormonal, and viral carcinogens. Again, the same can be considered as exogenous and endogenous carcinogens. Exogenous carcinogens are the carcinogens which are outside from our body, and the endogenous, the factors which bring the condition of cancer from the inside of our body itself. So regarding the exogenous carcinogens, These are the azodides or polycyclic hydrocarbons, nitrous amines, nitrous amide or benzyl pyrene. These are the usual chemical carcinogens. All of you know that, especially in Tattakadas, you can see the same oil is repeatedly boiled for frying so many things. So repeated use of already used oil, like that repeated use of already used tea or coffee, that will results in polycyclic hydrocarbons, nitrous amines, nitrous amides, aromatic compounds, benzyl pyrenes. These chemicals will surely derange our genetic pattern and acting as chemical carcinogens. And regarding the endogenous carcinogens, the hormonal, especially the sex hormones, then imbalanced level of estrogen, etc. may excite or acting as an endogenous carcinogens. And in men, the smegma may itself excite or irritate and thereby acting as an endogenous carcinogens. So these are the exogenous and endogenous carcinogens. Next, about the radiation. Uncontrolled exposure to radioactive substances, usually from X-rays or CT machines or electrical welding or painting or petrochemical industries. So uncontrolled exposure of the radioactivity that causes chemical changes in the cell and thereby formation of hydroxyl radical with a depolarization of nucleic acid molecule and chromosomal damage. So the ionizing radiation that causes chemical changes with formation of hydroxyl radicals with a depolarization of nucleic acid molecule and chromosomal damage. And next, about the viruses. You know that the main strain of viruses may belongs to DNA and RNA virus. The DNA virus that affects the genetic property or genetic material, whereas the RNA virus that affects the synthesis of various proteins, which are very essential for the various types of metabolism in our body. So the DNA virus that affects the genetic property and the RNA virus that affects the synthesis of protein and thereby exciting or bring a condition of cancer. So the risk of cancer, a possibility or the risk factors of cancer can be summarized, or who are the persons they are prone to have the possibility of cancers are usually in patients with who are living in low socio-economical conditions and who is having any habit of high intake of salt or salty food or pickles or acids or spicy or fried or smoked fish or smoked meats. And we mentioned it earlier, that is repeated use of already used tea or repeated use of already used oils, etc. that will leads to production of uncontrolled amount of polycyclic hydrocarbons. And more than that, the common cancer, the third to fifth cancer death in our worldwide level is due to the carcinoma stomach. And regarding the carcinoma stomach, one of the main cause behind that means near about 85 to 90% of the carcinoma stomach are mainly due to H. pylori infection. So Helicobacter pylori infections plays a great important role in the carcinoma stomach. That means near about 85 to 90%, so that the H. pylori is considered as the complete carcinogen. That means first of all it will leads to have a condition known as gastritis, then a peptic ulcer, then erosions, then atrophic gastritis or chronic gastritis, something like that. Conditions may finally change into anaplastic and dysplastic changes, and thereby finally the same will settle in as a CS stomach. So H. pylori infection is considered as the one of the main trigger or main maintaining cause of CA, especially GIT. Then regarding the deficiency of certain vitamins, especially the vitamin A, vitamin C and vitamin E and noble selenium, the deficiency of selenium, and finally in patient with immunodeficiency disorders, other than so many problems, then more than that, blood group A personalities are prone to have the possibility of high possibility of CA. Then next about the causes of cancer can be sum up as the diet constitute about 35% of the cancer, and various types of tobacco. The tobacco causes near about 30% of cancer, and the radiation, sunlight causes near about 10% of the cancer. Otherwise, the viruses about 7% and occupational only 4%, and alcohol that leads to 3% of the cancer, and radiation of 1%. And histologically the CA cells appear with a very large nucleus. That means the total size of the cell is getting shrinked. That is why the nucleus seems to be appear a large nuclei, and with a hyperchromic. It is very congested, very hyperchromic, with aberration in chromatin network, with the loss of some cellular proteins. On examining CA cells, you cannot see some specialized proteins. That is the loss of some cellular proteins. And here one of the main peculiarity of the CA cell is normally globulin will react with the normal cell and not with the CA. That means by gram staining or staining the cytological study. While doing the staining property, normally the globulin will react with the normal cell and not with the CA cells. So it is due to the loss of some basic protein. And about the microscopical appearance. The microscopically, the CA cells are highly deficient cytoplasm. Cytoplasm is very poor, highly deficient cytoplasm, and there is reduced size of mitochondria with irregular cristae. The size of the mitochondria is too small to the cell, and degenerating mitochondria can also be seen with a reduced number of RNA. So by this, all these properties, the histological report come in front of us as the given specimen is malignant one or not, either benign or malignant, something like that, depending on the histological or the microscopical peculiarity. And finally, let us see what happened, all these changes, how it affects our cell. That means the physical, chemical, biological, viral, hormonal, exogenous, endogenous, lifestyle, food, etc. Finally, that affects our genetic property. As you know, one of the main factor which regulates the normal cellular life, normal cellular lifespan, normal cellular death, everything is mainly balanced by so many types of genes. But there are two main set of genes which are very responsible for the normal lifespan of a cell. These genes are P53 genes and oncogenes. Let us see the P53 genes. Here the P53 genes acting as a brake pedal of our vehicle, and the oncogenes will acting as acceleration, that will give speed. So anything which affects the balance of the P53 and oncogenes, that will totally demolish the cell. That means total an accident, and the same accident will damage the cellular balance, and thereby you can see there is uncontrolled production of immature, irreversible, abnormal multiplication of varieties of cells within very short span of time. In normal cellular growth, you can see the one cell is divided into two within a very specific period of time, and from the 2 into 4, or from 4 into 16, or 4 into 18, something like that. In imbalanced P53 and oncogenes, that already happened, the one cell is again divided into 16 and 16 into 60,000 within a very short period of time. That is why in so many types of cancer, the tumor cells grow in a very rapid manner. That is the main mechanism behind it is our main P53 and oncogenes. Okay, here the P53 gene and oncogene plays great important role, and finally all these changes that will leads to cancerous condition. Let us have a look over this, the normal cellular lifespan, normal cell division. Here you can see the one cell is divided into multi-number within a very short period of time, and more than that, depending on the site and the type of the cell that affected with the carcinomatous or neoplastic changes, the cancer can be named in various levels. When the cancer cells that affects the gland, it is known as adenocarcinoma. When it affects the cartilage, it is chondroma, and when it affects the blood vessel, it is hemangioma. When it affects the fat, it is lipoma. When it affects the pigment cells, it is the melanoma, something like that. Myeloma or myoma or osteoma, osteosarcoma, something like that. So these are the main issues, main mechanisms, main secret behind the condition of cancer. So a very balance between the genes, they get totally disturbed by the physical, chemical, biological, viral and genetic issues. That is lifestyle, food style and genetic issue that will leads to uncontrolled multiplication of cells and thereby irreversible cellular growth. Once it started, you cannot reverse the condition. So that is why it is very irreversible, it is abnormal and it is very uncontrolled one. That is why it is known as cancer. Okay, thank you for watching.